Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Thrombocytopenia is a condition where your blood has a lower than normal number of platelets. Platelets are tiny blood cells that help your body form clots to stop bleeding. They act like little bandages, clumping together at the site of an injury. When you don't have enough platelets, you can experience excessive bleeding. This bleeding can occur anywhere in the body. It might show up as small red or purple spots on your skin called petechiae. These spots often appear in clusters and may look like a rash. You could also have larger bruising than usual. Thrombocytopenia can range from mild to severe. Some people might not even know they have it. Others may experience spontaneous bleeding that requires immediate medical attention. This condition is not always a cause for alarm. It's often temporary and resolves on its own or with simple treatment. However, it's important to understand the causes, symptoms, and treatment options for thrombocytopenia. There are several reasons why you might develop thrombocytopenia. One common cause is an autoimmune disorder. In these cases, your immune system mistakenly attacks and destroys your own platelets. Certain medications, like chemotherapy drugs, can also lead to thrombocytopenia. These drugs are powerful and can sometimes affect the bone marrow, where platelets are produced. Infections, both viral and bacterial, can also impact platelet count. These infections can temporarily disrupt the bone marrow's ability to make platelets. Other factors that can contribute to low platelet count include pregnancy, excessive alcohol consumption, and certain types of leukemia. It's important to work with your healthcare provider to determine the underlying cause of your thrombocytopenia. Many people with thrombocytopenia don't experience any noticeable symptoms. When symptoms do occur, they often involve bleeding that's difficult to stop. One of the most common signs is easy bruising. You might notice bruises appearing on your body even without any significant injury. Another telltale sign is bleeding from your gums, especially after brushing or flossing. Nosebleeds that are frequent or last longer than usual can also be a red flag. In more severe cases, you might see blood in your urine or stool. Heavy menstrual bleeding in women is another potential symptom. If you experience any of these symptoms, it's crucial to seek medical advice promptly. Section 4. How doctors diagnose thrombocytopenia. Diagnosing thrombocytopenia typically involves a simple blood test called a complete blood count, or CBC. This test measures the number of red blood cells, white blood cells, and platelets in your blood. If your platelet count is low, your doctor might order additional tests to determine the underlying cause. These tests could include a bone marrow biopsy, where a small sample of bone marrow is extracted and examined under a microscope. Your doctor will also ask about your medical history, including any medications you're taking and any recent illnesses. Be sure to inform your doctor about any family history of bleeding disorders. Section 5. Treatment and management of thrombocytopenia. The treatment for thrombocytopenia depends entirely on the underlying cause and the severity of your condition. For mild cases, no treatment might be necessary. Your doctor might simply recommend monitoring your platelet count with regular blood tests. If your thrombocytopenia is caused by a medication, your doctor might adjust your dosage or switch you to a different drug. For autoimmune thrombocytopenia, medications like corticosteroids can help suppress your immune system and prevent it from destroying platelets. In some cases, a platelet transfusion might be necessary to quickly increase your platelet count. This procedure involves receiving platelets from a donor through an IV. If your condition is chronic, your doctor might recommend other treatment options such as splenectomy, which involves surgically removing your spleen. Remember, thrombocytopenia is a manageable condition. With the right diagnosis, treatment, and lifestyle modifications, you can effectively manage your symptoms and prevent complications. Always consult with your healthcare provider for personalized advice and treatment plans. UMCC, your ultimate medical consultant connectors.